Hi, and welcome back to the Dr. Ramsey Show. Today it's just me, and I wanted to clarify something because I've been getting a lot of questions about my hip replacement. So, the reason that I needed a hip replacement is because I have a genetic condition called hip dysplasia. When I was born, my feet were crossed, same with my brother who's a year older. He got 2 hips last year. And just in my family tree, genetics, how strong this goes, my 2 grandfathers, one on my mother's, one on my father's side, were sitting in wheelchairs because of hip dysplasia themselves. And I think my 2 boys also have a little bit of touch of it. So it was a surgical necessity because I've been doing injections for 3 years of stem cells and PRP. And yes, it made me feel better, but I just can't heal a genetic issue like that that's structural. And I'll be needing a left hip at some point as well. The other thing I really wanted to touch on today, Rosie, my nurse, has been asking me to do this for a while, is to talk about this long COVID. Because we have some patients that are going through the treatments right now. And, it's easy to get bogged down. It's easy to get nervous that you're never going to get back to your normal self again, to have this level of fatigue that you've never had before. And what she wanted me to share with you is how well a certain IV that we do works to treat post-COVID long haulers. The IV is called NAD. I've talked a lot about NAD before, but what it does specifically is pull out all the inflammation, all of the waste products, let's say it's from the vaccine or from the actual infection. NAD really gets that out. Sometimes it's 1 IV, sometimes it's 10 IVs. We really can't say how many, but the one that's really going to push out the inflammation is NAD. And Rosie had gone through post-COVID pretty bad in the very beginning of COVID. And for her, the thing that turned her around as well was the NAD IVs. And she lost hope there for a while. And that's why she wanted me to talk about this is, she kept thinking, am I ever going to get my energy back? Is my hair going to stop falling out? Am I going to ever have no pain again? And now she's free of all that because she did enough of them. And I just want you to know there's something that you can do because I know how nerve-wracking it can be. So thank you for listening. And I hope you have a beautiful week. We'll see you again next week. Bye-bye.